Welcome to LECOM Health. Our guest today, making a return appearance, thank you, is Dr. Ryan Lynch, the stroke director of LECOM Health. Welcome, Ryan.
Thank you, Monsignor.
Thank you very much for being with us.
Thank you.
A friend of mine on the way down here just got a text message from his wife that his sister was having a stroke and went to a hospital and is going to be evaluated for it. My point to open that up with is hopefully she will be fine.
Yes.
But strokes are very relevant. I read like 800,000 people a year
Correct.
get strokes. Can you tell us overall first, what are the two kinds of strokes? Or perhaps there are more. But I understand there are fundamentally two different types of stroke and what it actually anatomically is.
Correct. There are pretty much two types. There's one is a bleeding stroke. So an artery in the brain will basically rupture and bleed on the brain, which is not good. And also a clog stroke. The clog could be, so this is where some people think of three types of strokes. You can have a slow drain over time, a tube clog slowly over time, your artery causing the stroke. And you can have a clot come from somewhere else, either a carotid artery in the neck or from the heart.
So we seriously are talking about a serious deficiency if somebody has a stroke.
Correct.
So if people are listening to this and we're saying to them, strokes are prevalent, they're something to be very carefully treated and watched, what are some of the normal symptoms that people should pay very close attention to if they think they're approaching having a stroke?
Great question. I think a lot of strokes start out with a weakness or a heaviness people will have in their arm or a leg. Strokes typically, with rare exception, occur on one side or the other.
Why is that?
It's kind of the way our Creator created us. The left side of the brain controls the right side for the most part, with rare exception, and vice versa. So that's usually what happens. Now, if you have a clot that's thrown from the heart, it can shatter, so to speak, on the way up and basically clog both sides of the brain, causing problems on both sides of the body. But I'm trying to think where I was going with that.
You were going with, before I rudely interrupted you, that basically if heaviness is one of the symptoms.
Heaviness, I like to say, because it's a subtle sign. You know, we always say that my resident physicians laugh at me when I always say time is brain, because I say it all the time. But the earlier we can get a patient to the ER to be treated, the better they do, both in the moment and in the long run. So a lot of patients will think heaviness just means that I'm tired. And I just need to go sleep it off. And the clock starts ticking as soon as that heaviness starts, which usually is a nice term for light weakness. Numbness and tingling would be another new symptom that you should pay attention to. I always tell patients that have had prior strokes, I tell family members to look at their face, a facial droop that was never there before, where one side of the face sags. Mm-hmm. Slurred speech is another one. It's amazing how many older patients 50 and older, will poo-poo these things and just think they're tired and go to sleep and basically sleep themselves through the time that we can do something. And that's usually 0 to 6 hours is when we can really, really treat a stroke well these days.
When you say numbness or tingle, and everybody has, your arm falls asleep or something like that, can you talk a little bit about what that feels like?
Sure. If we all remember when we sit cross-legged on the floor too long watching television, and then you stand up and you have that tingly, sometimes prickly feeling, and our limbs are numb, that's kind of numbness and tingling. So numbness is a lack of sensation in the body, and tingling, or paresthesia as medically it's called, is a tingling or prickly sensation in the extremity. And as Monsignor pointed out, we all, especially as we get older, things start to break down, and we may have numb feet or tingling feet with diabetes, or tingling hands from carpal tunnel syndrome. This would be a new symptom, this is a new finding in you as you're looking at yourself in the morning or when this starts.
Is it painful, the tingling?
Typically, no, but some strokes, depending on where they are, like in the thalamus, a part of the brain, can present with pain, which are difficult strokes because you may not think that's a stroke. Even other doctors may not think that acute right arm pain is a stroke, but it can present that way. Those are the scariest strokes because it's not your typical type of stroke.
So if someone is feeling some of these symptoms, what should they do?
I always say call 911 and get to the closest ER. However, if you're concerned you don't want to look like a goof or whatever, you could call your family doctor as well right away and ask them, and I'm sure they're going to tell you to go directly to the ER. I do not like patients driving themselves to the ER because we always forget in the ambulance, those EMS providers can provide care while en route. Or even I've had patients that were getting so worse, they pulled over and had a chopper take them to a hospital out of the ambulance, which you can't do out of your own car too easily. So 911 is the best way to go. And I have a lot of patients too that live in the surrounding areas and don't like the closest local hospital. But I tell them they're all equipped to treat stroke, and if they aren't, they have a helipad typically where they can life flight you to a bigger, more appropriate hospital.
And so when they get to the hospital, what generally will happen to them in terms of their initial workup?
And before I forget, I think stroke symptoms are okay to cry wolf to. I mean, there's no doctor that's going to yell at you for a stroke symptom in an ER, like being over careful. But once you get to the ER, usually they'll call a stroke alert in the hospital, which mobilizes you ahead of everybody else they get a CAT scan of the brain. They'll usually draw some blood to look at your platelets, which are factors in the blood that clog it. They'll also look to see if your blood is thinner or thicker than normal, and they'll check your kidney function in case they have to give you a contrast in one of these studies. But they'll also check a glucose. Our diabetics, if they take too much insulin and drop your sugar to like 15 or 20, that can be a stroke mimic. It looks like a stroke, but it's not. But you can be guaranteed that you're going to get a contrast or a non-contrast CT of the head once you hit the ER. And that's to look primarily for a bleed, because a bleeding stroke you don't treat with the clot busting agent, TPA, or tissue plasminogen activator.
How do you treat a bleeding stroke?
Usually you have to call a neurosurgeon and have it evacuated by a neurosurgeon acutely. And the stroke alert system alerts the hospitals that have that capacity to do such a thing.
So get to the hospital and get checked in.
Correct.
So we've talked about what a stroke is anatomically. We've talked about the signs and symptoms of strokes. And then if someone has that, they should not be afraid of crying wolf. Go.
Correct.
And have somebody take care of you and take a look at it. We've talked about the initial workup. So if I'm sitting here at home, are there things that I can do to prevent getting a stroke?
Absolutely. We being the third largest health system in the area, most of my strokes are odd in that I'm 50 and most of my strokes are younger than me that I see here for a large part. And
is that unusual?
It is kind of unusual, but I think we're skewed because we're the third stroke center in a city. With another health system being a comprehensive stroke center, a bigger stroke center, they probably have most of the majority of the normal statistics. Mm-hmm. But I see more and more strokes in the 40s than I ever did in the past. And I'm not sure exactly why that is, but it is present. A lot of people don't take care of themselves. I mean, you want to have a balanced diet without too much fat. It's amazing, these vaping devices, I think, have re-addicted our society to nicotine. So and
nicotine is a bad agent.
Correct, because it raises blood pressure. A lot of folks think because it's vaping and not tobacco, you're saving yourself from tar, which may be accurate from that standpoint. But if you're vaping any device that has nicotine in it, it has an oil-based media to put that nicotine in. So you're still polluting your body with an oil, which can clog your arteries.
Are older people more prone to strokes?
Correct, yes. Usually 65 and older, because they've enjoyed a life of smoking and eating cheeseburgers and clogging our arteries.
And that's fundamentally it. So high blood pressure is obviously another
Absolutely.
concern?
High blood pressure is the number one cause of strokes in the United States, yes.
The number one?
Number one.
And so people who obviously aren't telling their primary care doctors or paying attention and going to primary care doctors are walking around as time bombs.
Correct.
Pretty much ready to blow up.
Correct. And I'm 50, like I said, most of my friends, it's amazing. They'll say they have a headache and they say, hey, can you check your blood? Can I check your blood pressure? I check it. It's high. And I'm like, don't you go to see your doctor? And like, I don't have a doctor. I don't know how you can be in your 40s and 50s without a doctor let alone not treating something. So,
Oh, Lord, no, Ryan. I know what's breaking down. I see more pills than I know what to do with. But I didn't realize high blood pressure is the number one cause of strokes.
yes, or I should say untreated.
Untreated.
Yeah.
Are there medications, preventive medications that people can take if you as their physician think they may be predisposed towards that?
So if they're predisposed or had a previous stroke, and you want to do this under doctor's care, usually they'll start you on an antiplatelet medication, which could be as natural as an 81 milligram dose of aspirin or a medication called clopidogrel or Plavix. Otherwise, a blood pressure pill, usually in the stroke world, although anymore it's getting a little less used, but old ACE inhibitors were considered a little bit better of a medication for strokes, for blood pressure than other blood pressure pills. But I would just say keeping a normal blood pressure with a medication of 120 or less would be sufficient in these days. And we recommend using a statin medication for controlling cholesterol, primarily the LDL cholesterol, or what we quote unquote call the bad cholesterol. Mm-hmm. Statin medications, though, brand names would be like Lipitor, Crestor, Pravachol. These medications do have their side effects. So again, it's got to be under doctor's care. But those would be, usually we want to have a blood thinning medication such as aspirin, a blood pressure pill such as an ACE inhibitor, and then a statin medication for cholesterol.
And if I do these preventive medications, that obviously doesn't eliminate the possibility of still having a stroke. And this is a very unfair question to you, and I apologize before I even ask it. But in terms of recovery, obviously it depends on the size of the stroke, what the recovery prospects are or are not.
Great question. So I always like to use the analogy of how our brain and the vascular system in it mimics a tree. And so as Monsignor was asking, is bigger or worse than smaller? Well, it all depends on where it is in the tree. If you took a tiny stroke and put it in what's called the brainstem or the trunk of the tree, you can greatly affect the whole tree by affecting the trunk of it. So size doesn't always matter with stroke.
So back here.
So it'd be location, yes.
Which could be really problematic if it's in the brainstem.
Correct, yes. In fact, if it's big enough in the brainstem, you have to worry about swelling there, which can actually cause death within the first, usually 3 to 5 days of a stroke. So the edema or swelling with a stroke in a location like that could be life-threatening, things we don't think of with strokes.
And if it's somewhere else in the brain?
If you're a right-handed person and you're left brain dominant, there's a part of your brain called the parietal lobe. If I could probably put a golf ball sized stroke on the right parietal lobe in a right-handed person, and they'd have little to no side effects from it. So a lot of patients are always surprised when they see me for things. Maybe they're 65 years old, I'm seeing them for migraines, and I get an MRI, and I tell them, just so you know, you had an old stroke. And
that happens?
Yes, and without them ever, seeing a doctor.
God, I get migraines, and now you're going to panic me all week, and I'm going to have to take me in when we're done with this.
And they're like, "How could I have a stroke if I never knew I had it?" Well, it's the old adage, we only use like 10 or 15% of our brains. That's in some ways that's true. So you can have a stroke and not know it.
How about the left side?
If you hit the left side, that's called eloquent brain, or brain that's utilized by a primarily, if we're talking a right-brained, a left-brained, right-handed person, that you need any size stroke is going to cause a problem because it's the dominant hemisphere.
How about us left-handed people? Are we more prone?
So the studies.
There's only 8% of us now, I think you said.
Yeah. The study shows that I find myself to be an analytical lefty. So I'm probably left-brained as well. Only 30% of lefties are right-brained, and it's usually the very creative, artsy type of lefties. Mm-hmm. I'm not sure if you are that type, but
either or, it depends on the day of the week.
But as a stroke rehab specialist, I will tell you that most left-handed people are ambidextrous to some level, which is a very good thing during stroke rehab. If you're ambidextrous, you tend to do better than a right-handed person.
I've heard the term golden hour when someone gets a stroke, or there's a drug that you can give early on in the stroke. Is there any truth to that?
Correct, yes. So it's the primary drug used across the United States and the world is tissue plasminogen activator, or we call it TPA. And the golden hour is more of a 0 to 4.5 hours where it can be given intravenously through the veins. And there's also a 4.5 to 6 hour mark where it couldn't be given through an artery. They literally have, just like a cardiologist would snake a catheter to your heart, you'll have a neurologist, a vascular neurologist, who will snake a catheter to the brain to find the stroke and then squirt the TPA right at the spot. However, in a lot of institutions, comprehensive stroke centers, they may go out 12 hours. I've had cases here where we have someone who was discovered, they came in 8 hours after the stroke and we transferred them out because they would, a lot of times a stroke physician feels it's better to try something than to just let them have the stroke or get worse. So, but in most cases, 0 to 4.5 hours is the time period to get to the hospital.
But overall, clearly, if one is having those early symptoms you talked about, and if you could review them, a heaviness, a tingling.
I like to use subtle, we call these subtle symptoms. So a little bit of tingling that's new. Anything that's new in your body should be taken seriously. A new facial droop. We always use the expression fast. You want to look at the patient's face, look at their arms. So I tell a lot of my patients who always are concerned to stand in the mirror and put their arms out in front of them and see if if they can't keep one of their arms up. That could be a sign of a subtle weakness. Mm-hmm. You want to see for any asymmetries in the body where one side's number than the other, and that's new. And I have them smile in the mirror too. There's a lot of times where I'll ask to see the patient's ID to see if the smile, the droop is old or if it's new. Sometimes we use things like that. But numbness, tingling, decreased coordination is another one. One of the scariest symptoms of a stroke, it happens in about 5% of strokes, is the only symptom that they present with is dizziness, which can be typically the most common reason for that's an inner ear problem, mm-hmm. or their blood pressure is too low. So a lot of patients don't present to the ER until a day or two after the stroke with dizziness. And at that point, unfortunately, there's not a lot to do.
There's not a lot to do. And then if they have any of those, go to the hospital.
Correct. Yeah. 911.
911 and get to the hospital. And nobody's going to yell at you for crying wolf.
I don't think so. I would never do that.
No, this is a very serious condition. Thank you very much for being with us. Thank you for all you do to take care of stroke people and getting them back to health. And this is LECOM Health Matters. Monsignor David Rubino and our good friend, Dr. Ryan.
Thank you, Monsignor. Thank you, everyone.
Thank you.